Hi, my name is Leanne May, and this is my presentation on long-term care funding. Who is responsible and how can they afford it? I think it's important before we start talking about how you can afford long-term care or what your options are to actually define what it's meant by long-term care. It is usually considered non-medical care or custodial care for patients who need assistance with basic daily activities such as dressing, bathing, and using the bathroom. Long-term care may be provided at home or in facilities that include nursing homes and assisted living. Long-term care can be broken down into formal care, such as skilled nursing care, assisted living facilities, home care, hospice care, respite care, adult daycare, or informal, which is provided within the home by members of the family or members of the community or religious affiliation. There are a few alternatives that have come into existence to kind of offset the amount of institutionalized care that exists. Aging in place has become quite common where people remain engaged in their own care at home within the context of family. Retirement homes and life care communities are more common for those who do not wish to stay in their own homes as they age but do wish to avoid institutions, often because of the reputation that they have gotten over the years. Although there have been vast improvements, a lot of legislation has been passed to standardize care for those kinds of medical and assisted living facilities. You also have high-tech home care where you can have a registered nurse or a licensed practitioner come in and do, possibly monthly infusions or IV treatments if need be, but it's all done within the within the context of the home and is usually more cost effective. And then you also have a lot of naturally occurring retirement communities. They're especially popular here in California. They're called 55 and over only communities, and unless you meet that minimum age requirement, you're not applicable for the living facility. And they often look just like apartment homes, so they're very comfortable and they're very friendly and warm and inviting versus maybe a large building with little rooms as you would find at most institutions. So here are two graphs that depict the actual cost of long-term care. I did set them up to be reflective of the cost here in California so that it would show that here we actually pay some of the highest prices for long-term care. As you can see, nursing homes are the most expensive. They have the most amenities and are usually for those who cannot function at all on their own. But then you have all the way down to adult daycare, which is an average of almost $20,000 a year. Most of these are well outside the annual gross income of seniors. So most people have to find some way to be able to afford it aside from their Social Security benefits and anything they may or may not be getting from Medicare to help out with medical expenses. I would like to say that different states reflect different prices, and some are much less expensive than others, but you do need to keep in mind that the cost of living does fluctuate from state to state as well. So although the cost may be lower, if you're making less money based on your retirement, based on where you retired and what you were making when you retired, that does have an impact. So there are a lot of factors that can affect long-term care or that are affecting it now and have been affecting it for quite some time. We have a ever-growing aging population in America that require long-term care versus 50 to 75 years ago. People were not living as long and medical advances have greatly changed that demographic. The reality is that 70% of people over 65 will need some sort of support to assist them with daily activities at some point in their lives for at least an average of 3 years. Many will only need a couple of weeks if they decline rapidly, but average is 3 years. Informal care, as much as it does tend to keep costs down from a financial perspective, it is extremely strenuous on those that provide it, and so that can in turn affect the kind of care that their family member is receiving from them. And then the big question is, how will older Americans, as well as their middle-aged children, use the income, savings, and property they have acquired through lifetimes of hard work to provide themselves with appropriate living conditions and access to quality health for the remainder of their lives? So long-term care funding options. You have both the private sector and the government-funded section. There are benefits to both, but there are also some serious drawbacks. You can kind of see that in the points there. With private sector, you end up having a lot less red tape and bureaucratic nonsense to have to get through. And because it often is nonprofit, the care that the elderly and their families receive tends to be less financially incentivized, and so there are some benefits to that. But with lack of funding, obviously there are drawbacks as well. Um, Federal programs that fund the majority of lawn care services, like Medicare, Medicaid, and Social Security, um, they're not originally designed to meet long-term care needs, especially at the rate at which they're growing. So those programs are strained, and are finding it hard to keep up. In fact, they've already fallen behind. And so, it's important to see what your options are for planning for long-term care. So some alternatives are self-pay. Some individuals, the rare few, have enough money from retirement or that they've put away over the years, just in the bank, to be able to pay for it out of pocket, especially if they don't need it for very long. My grandmother died within a matter of 2 or 3 weeks, and she had set herself up to be able to go a year or two on that kind of care, and she didn't end up needing it, thankfully. Other people will rely on government benefits, and that's a nice thing to have, but it doesn't usually cover the entire cost. You do have traditional long-term care insurance or long-term care insurance subsidized by the government or provided by the government, often through employers. You can do combined annuity and long-term care benefits. You can do a life settlement policy, or you can even have an IRA that you've set up. But whatever you choose to do, make sure that you start planning early. The earlier you plan, the more money you can put away, the better off you will be to be able to have quality of life when it comes time for you to enter that end stage of life. So here are my resources. I hope my presentation was informative and helpful, and that you will be able to make a choice that best suits your financial situation and the needs that you anticipate having. The best advice I can give is that even if you don't think you'll need something, it's better to have it than not have it. So you may not have a chronic condition now, and one would hope that you would practice healthy lifestyle habits to help avoid those types of problems. But even the healthiest person can have a heart attack or have some kind of a sudden onset. So just to be aware of physically where you're at now, to try and take care of yourself as best as possible, and hopefully have good quality to the end of your life. Thank you.